You can
Would
see the full
people,
screen?
sorry, Clarissa, would people like to turn their cameras off during the presentation, and then it just it makes it easier for the recording, and then we can pop them back on later. Super, thank you. Sorry, Clarissa.
It's fine. I can't see anyone anyways. I can just see my slide and you right now. So it'll be speaking into the abyss, I think. But yes, thank you very much for inviting me to give this talk. I don't think I know many people in this call, which is always nice to meet new people, as long as albeit it's being virtual. So my name is Clarissa Giebel. I'm a senior research fellow at the University of Liverpool and the Applied Research Collaboration Northwest Coast. And my research primarily looks at inequalities and inequities in dementia care and aging. So what happens to people after a diagnosis, and how can we try and address inequalities, both on a national and an international scale as well. As part of this, and I feel trying to embed equality in the dementia care system, I'm also incredibly passionate about trying to embed equality in how we can involve people with the lived experiences, but also the non-academic professional experiences. So health and social care professionals, charity organizations, decision makers, etc., in the research that we do. So today, I'm going to give a talk which is linked to my Career Development Award from the Three Schools Mental Health, looking at involving public and stakeholders to conduct meaningful dementia research. My slide moves. Okay, so first of all, just a very brief snapshot of my Career Development Award, but then I'll go into more depth about the public involvement that we do, and specifically about a couple of examples of in-depth public involvement and research that we've conducted in the past 2.5 years, which have led to this particular project and award. So I was very lucky to have been awarded this funding, and it's an 18-month project which looks at unmet mental health needs of unpaid and paid carers for older adults with and without dementia. Now, simultaneously, I've also been awarded from the University of Liverpool a 7-month project funding, which has now ceased, but it's been linked to this. So we've kind of combined the pots of money to look at a larger sample size. What we're going to do as part of this is we're conducting interviews, and I'll go into more depth about this after I've illustrated the public involvement angle. We're conducting focus groups and co-production workshops, all with unpaid and paid carers, but also with care providers, because we want to understand what might be the barriers or facilitators at the moment or in the future of enabling more equitable access to mental health for carers. And there's also a couple of training courses for myself as part of this award. So this is the topic of the project, but how did we get there? So some of you may know this already, might be a little bit familiar with this. In 2019, I set up the Liverpool Dementia and Aging Research Forum, and how this idea came about. So I joined Liverpool 5+ years ago, and I noticed there's quite a few dementia researchers across the university and the universities in Liverpool, but also a great deal of untapped knowledge and interest and passion and dedication of health and social care providers and lots of charities, but also a lot of lived experts. So people living with dementia and unpaid carers who are really keen of getting involved in research, shaping research, etc. So I thought, okay, let's try something. It certainly grew since then, but it's really probably one of the highlights of my job, and I always enjoy it, always make time for it, because it's really much more person-centered than some of the work that we might do, being stuck behind data, etc. So there's 4 different activities, but really there's 2 aims to this forum. The first one is to connect. It's to connect lived experts, care providers, us academics, our postgrad students, our PhDs, etc., and all come together and try and think about and co-produce meaningful research. The second aim of this forum is to try and educate and raise awareness of research that's going on, of services that are existing, but some people might not know about them, etc. So we have 4 activities every 2 months. There's public webinars. We have monthly journal clubs, which is well attended by the Alzheimer's Society, for example, as well. Twice a year, we have face-to-face now regional networking meetings. So there's a few service providers who are sharing their services, and we're discussing and trying to generate new ideas for research. And then we have our annual conference, which takes place usually in October. Sorry, just clicking slides. There we go. So this was the last face-to-face talk that we held before the pandemic. That was done by Dr. Rhys Davies from the Walton Centre and was about rare dementias and different subtypes of dementia. So you can see quite a full house, which was lovely. And since then, obviously, we had to move everything virtually. But nevertheless, it's still grown and we've been back to face-to-face meetings since. But some of the examples of things that we do, for example, on our ARC Northwest Coast YouTube channel, you can go on there and all our talks are there if you want to have a listen back. But also we have quite a few talks from Roy, who's living with dementia. He's one of our what we call public advisors. He's really helped shape quite a few of our research projects, the earlier research projects, because unfortunately he's deteriorated with his Lewy body dementia quite a bit now. But in those videos, you can see why he's taking part in research and a little bit more about him. And obviously us as a team, we attend different conferences, etc. as well. And here, that was also just before the pandemic, but this has now merged into other activities that we do. So this was a specific public advisor meeting where we had a large group of people living with dementia and unpaid carers, and we've got this supported by Mercy Care on the left side. We've got Dr. Sarah Butchart, and we had some international visitors there from Maastricht University as well. It's really the different types of activities we do to discuss and really hear about what do you think is important? What do you think we as researchers with you should tackle right now? And as part of this, and I'll go more into the different activities that public advisors have in our research, but all the research that we do is co-authored by the public advisors as well. So here, for example, you see a screenshot of our first COVID-19 research, and it's more than half of the team was non-academics, and that was really nice as well, and really different experiences that were shared there. And here, just lastly, about the forum, that was our fourth annual conference in October, finally face-to-face again. We had 150 people approximately in attendance. Yeah, and it was just nice to see everyone face-to-face again, and again come up with new ideas, but also celebrate all the work that we've done together. So that's the Liverpool Dementia and Aging Research Forum. And that has enabled us as a team to come up with new ideas. And specifically, I'm going to talk about now research. This has been published, which has looked at the impact of COVID-19 on social care for people with dementia, both residing in the community, but also in care homes. Now, the idea for these studies came up in discussion with our carers. So I've already had these established relationships with carers, and they came up to me when the pandemic hit and said, we're really worried about what's going to happen with our relative now with dementia, with the lockdown, with the restrictions, what's going to happen to us, etc. So we were lucky to receive funding very early on in the pandemic in March 2020. So on the left side, you see the qualitative kind of methods and sample size of a mixed method study that we've done. That was the very first one. And the reason why I'm highlighting both of those here is that findings from those two studies, which were heavily co-produced, then led to my Career Development Award project idea. So what did we do? In April 2020, the qualitative component of our first study was to conduct a rather large amount of qualitative interviews with unpaid carers, people with dementia over the phone, over Zoom, over Teams. And the reason why this was such a large sample, we were quite inundated positively with people wanting to share their experiences, because there wasn't really much other outlet to express their feelings and worries and concerns. But also, obviously, we want to get a large representative sample across the UK. Then a few months later, we followed this up with 20 interviews with some unpaid carers and people living with dementia. And in addition to this, we also conducted a 3-time point survey, an online survey throughout the UK, where we specifically wanted to see whether reductions in social care usage for dementia were linked to mental well-being. Again, that is underpinning the Career Development Award, because it's all focusing on mental health. And I'll share with you the quick findings of that survey a few slides down. Now, that was our community-based research, and I'll share with you a few of those key findings shortly. But I'm now going to talk a little bit as well about the sample of our care home study, because again, that was interlinked. Findings from our community-based research led us to then look a little bit more about how carers are experiencing the entire care home situation and safe visitation, etc. So through a separate funding that we were awarded, we looked at the experiences of safe care home visitation during the pandemic. And again, we conducted remote interviews, this time with unpaid carers and care home staff. And the 16 care home staff are from across 16 different care homes in the UK. The first interviews were done between October, November 2020, and then we conducted 20 follow-up interviews in March. And as all of you will surely remember, particularly in that time period, so in December, we had increased testing, but also increased vaccination rollout, which led to some of those findings that we found in the follow-up interviews in terms of emotional distress. I'll go into that a little bit later. But also really important issue to discuss here in contextual information. In March 2021, there were sudden announcements from the government, 2 sudden announcements, that first of all, 1 essential visitor was allowed for care home residents. Second, a few weeks later, in March again, a 2nd essential visitor was allowed. Now, this only seemed to have been communicated from the government to the media, but not necessarily to the care homes, which again caused a lot of emotional upset. So, as I said, I'm just going to give you a very quick key highlight findings of all this co-produced research that we've done. So first of all, we noticed a faster deterioration of people living with dementia by their unpaid carers. So this was about the community-based research. And we found that previously people were accessing social services, social support services, etc. in the community, daycare centres, support groups, respite care, all these things, paid home carers, for example. But suddenly, obviously, there was this lack of social stimulation, the lack of cognitive stimulation, but also lack of physical stimulation. People were just stuck at home. So many unpaid carers noticed this deterioration and were really concerned about what might happen to my dad, to my mum, to my husband, when services might reopen again. Another thing we thought, though, was, and this was posed by the unpaid carers who were part of our team, again showing how important it is to have public advisors as team members, was that, well, maybe they're just more surrounded by them now. Before that, their relative was going to daycare centres a few times a week, they were having home carers, but now unpaid carers were taking on more caring roles. So maybe they're just more aware of it. Another thing we found that was really striking was the findings on paid home care. So we found that many unpaid carers were facing really difficult decisions about, will I continue having strangers effectively coming into my loved one's home, delivering that care, or will I take on those additional caring duties? Now, we know that at least for some people who are in the more advanced stages of dementia or generally are in need of greater support, there could be up to 10 different staff coming in a week. Now, if we think all these 10 different staff might bring in the virus, unpaid carers don't know anything really about the staff, so there's really an increased risk. So we had quite a few unpaid carers who decided, no, we're going to stop paid carers coming in, we're going to take on these duties. However, that obviously led to increased levels of carer burden because of the increased caring roles. Some other carers decided we just can't cope with not having this external support, so we'll have to have paid carers come in. So that was just a little bit of the key findings of the qualitative piece, but also, again, underpinning this mental health narrative. When we conducted our survey, and we had 660 people completing the first wave of the survey, and in total around 400 all 3 time points. So just looking at the first wave, and the data were collected up until May 2020, we found that reductions in accessing social care and social support services were linked to higher levels of anxiety in people living with dementia and older adults without dementia. But we also found that reductions in accessing social care and social support were linked to poorer levels of mental well-being in unpaid carers and older adults. So really illustrating that quantitative narrative now complementing the qualitative findings. And we also, because we don't want things to be stuck in that academic ivory tower, we developed some policy guidance in consultation with the Liverpool Heseltine Institute. You can access this freely. It's on their webpage. They've done quite a bit on COVID-19 and beyond. And really some of the key findings, there has been no support for carers in terms of care provision. Generally, we found very poor levels of mental well-being, and reductions in mental well-being were really linked to reductions in social care access and social support. So that was our first community co-produced piece of work. One of the findings that we found in the follow-up interviews from that community-based work was that a few of the people that were being cared for in the baseline interviews had to be entering a care home at the time of the follow-up interviews because unpaid carers couldn't cope anymore and couldn't deliver the care that was required for the people with dementia because they've deteriorated too much. So again, this led us to then look at care homes, but also we think it's just the increased levels of mental ill health effectively and lack of support for carers. This is hugely distressing, and it's doubtful that it's really been supported and addressed since. Effectively, it's a huge trauma to unpaid carers, and there will be to paid carers as well, which I'll go into in the care home study. So we wanted to look with, again, our public advisors, with some different public advisors this time, because what we try and do as part of our research is to obviously not work with the same on each project, but really spread the opportunities out so that many different people with different experiences can try and share them, but also, I suppose, build their capacity and raise their knowledge about how is research done and what can we try and do and help. So in our care home study, again, this is just trying to illustrate the story of why we then did the Career Development Award. We found that there were lots of different types of visits being enabled, if they were enabled in the first place. So many unpaid carers were unable to see their relative, and in limited circumstances, they were able to have pod visits, for example, so with a plastic screen. They were having garden visits if the weather was okay, window visits, as you can see here, and end-of-life care visits. Now, end-of-life care visits were held a little bit differently in that people were allowed, carers were allowed to go into the room of the resident, of their loved one, and hold their hand. We also found remote visits, but these were really, really difficult. I mean, all of them were very difficult for people with dementia, because it's so complex to understand. Oh, suddenly I'm not seeing my daughter, my granddaughter anymore. I'm having to see them through a screen. I can't hug them anymore. But also specifically with some subtypes of dementia, it was difficult to comprehend a little box on a mobile phone, for example, having a FaceTime chat, or on an iPad. What is that? If people are unfamiliar with that technology, it doesn't really benefit them. And we found it caused a lot of distress for the unpaid carers as well. There were some changes to visitation rights that we witnessed, that care home staff told us about. Again, there was no clear guidance on care home visitation for the UK. The only clear guidance that was implemented, well, globally, I suppose, was in the Netherlands in May 2020, which actually helped facilitate those visits much better. But unfortunately, we did not have them. So we found that some care home staff made these individual decisions where they witnessed that a resident was feeling really low, wasn't eating anymore. So they said, okay, I'm going to enable this visit. So yeah, but again, that just caused inequalities because some of the families noticed this and didn't understand why can they go in and I can't, which led to a breakdown of communication, as you can see here. So some people were allowed in, others weren't. So not all care homes were the same, but on the whole, we noticed that there was a general lack of communication from care homes to the families, which I suppose can be quite understandable because they had a lot of increased tasks to do, staff sickness, increased testing, etc. So much more work to do. So this might have slipped off their radar. However, it led to relationship breakdowns as well between the unpaid carers and the care workforce. But also, as I was mentioning a few slides earlier, there was a lack of communication from the government to the care homes in how safe visitation should be enabled. And again, this is incredibly stressful for everyone. So how is this being dealt with, not just for the unpaid carers, but also for the workforce? One thing that struck us in pretty much all of the interviews with unpaid carers was the level of guilt. Now, guilt wasn't necessarily specific to the COVID situation. It can already be there before the pandemic. And when that again illustrates the beauty of having people with lived experiences on our research team. So they were involved in coding some of the transcripts, for example. We supported them, we trained them up, and we gave each of the public advisors 1 or 2 transcripts, anonymized, obviously. And we asked them, right, we're doing thematic analysis, inductive thematic analysis, have a read through, and really supported them. But that meant they came to the virtual table much more empowered and prepared and confident and contributing as well. So when they read those transcripts and when we jointly discussed this, we were all saying, oh, guilt is really striking us. And they said, the former carers in particular, we already experienced guilt when we had our dad move into a care home before the pandemic because we felt we should really care for him, but we can't anymore. So this guilt came out in so many of those interviews, amplified by the pandemic, because having someone enter a care home during the pandemic in particular, people weren't aware whether they would see them again next week, or in a few months, or in a year. So really, really stressful. And the relationship breakdowns, again, that just creates the narrative of the mental health and just mental well-being issues that have been generated throughout the pandemic and that are long-lasting, but don't seem to have been addressed in the long term. So we found the relationship breakdowns between the residents and the families. And obviously, they can't get that time back. People are deteriorating in their care home. We found many relationship breakdowns between staff and residents as well. So here's a quote by an activity coordinator. Having to wear the personal protective equipment led to some difficulties, especially when you have non-clear face masks. So people with dementia might be struggling to seeing is someone smiling, is someone warm, and obviously having to be distanced from one another as well. It's very difficult to understand that if you have cognitive deficits. Why is this suddenly happening? And just to kind of lastly highlight from this piece of work, underpinning the Career Award, when we conducted the follow-up interviews in March 2021, we found that the frustration that was experienced by the unpaid carers in October the previous year was growing to anger in all of the carers. It wasn't necessarily that people have to say, I'm angry. You could tell in the subtext to the text, they were incredibly angry. And why were they? Because all of the unpaid carers were still not allowed to go in except one to see their relative, despite the announcement from the government. So then they were frustrated that the care homes hadn't implemented those decisions from the government quickly enough. But the key reason why people seemed to be agitated and angry about it was that care home staff was obviously still going into the care home, but not all of them were vaccinated. And unpaid carers knew that COVID was still making it into the home. So with unpaid carers being vaccinated, adhering to restrictions, but not allowed to go in, they see care home members of staff sitting close to their resident when they have a window visit, pod visit, etc. So really, the emotions were just supercharged and from frustration moving to anger. However, this has not been addressed yet, and it's really important that these relationships are being built up again with support from the outside. But it's not all just about the unpaid carers, who are incredibly important. We also wanted to focus on the paid care workforce, so the care home staff. Now, this is just one quote of many and of many findings that we found on the care home staff, but I suppose the key one was really the carer burnout. They have done a tremendous job without any support, unless they had a really supportive care home manager, in trying to navigate this system and trying to navigate, oh, suddenly we have to do increased testing, people are getting sick, people are dying on our watch and we can't do anything about it. So this will have long-lasting impacts on the workforce. Again, they need support to deal with this, which is not often provided. And here, just to illustrate, to try and bring these findings together with an international team from Germany and Australia, we've also conducted a systematic review, which you can read about, trying to understand the wide-ranging effects of the pandemic on people with dementia and unpaid carers. This was split into a two-part systematic review because there was so much evidence, but particularly looking at part 2, because this talk is all about carers, there were a large number of studies that found quantitatively and qualitatively, and including longitudinal quantitative work, that the pandemic has had a negative impact on carers' mental health and well-being. And again, we've done a policy briefing on this, and I'm also having a podcast. So if you feel you want to find out more about this, in this podcast, I've been speaking to a lot of care providers and researchers, not from our team, but in general from the UK and internationally, about these issues. So let's move to the actual study at hand. So just to kind of reflect, working with lived experts, so that's people with dementia and unpaid carers, but also working with charity providers such as TIDE, the Alzheimer's Society, the Lewy Body Society, we've got the Brain Charity, House of Memories, loads of different charities that are involved. We've got Me to You Daycare Centre, that's very active and dedicated here. It's so important to not just have us researchers on this, but to have everyone at the table. And I always find, working with non-academics as well, this passion that they have just spills over into the research and makes us all really, dare I say, giddy in actually doing the research, because it's much more, it's really empowering to work with all of them. And having worked with quite a few of them for a number of years now, it's really lovely to see how some of the initially rather shy Unpaid carers, for example, seem to have gotten a strong voice and feeling really confident in saying anything at team meetings and not feeling worried about, oh, there's a professor in the room or something. No, we're all equal. And for me, at least, I find their voices are actually more important than us researchers. We provide the methods and the tools to do the research, but they provide the insights into what really matters right now and how can we try and implement this in practice. So as part of my award, I've got 3 carers as public advisors, 2 unpaid carers. One of them has suffered severe mental ill health and is still being supported, and this has really emerged from the pandemic. And one is working in a home care service and daycare service. So really paid and unpaid carers as part of this. We've also got Professor Jill Anthorpe and Barbara Hanratty as part of this, and a health psychologist from LSCFT NHS Trust. So a nice mix. And so far we've conducted 36 interviews, majority of them with unpaid carers of those with dementia and those without dementia. And we're still trying to find a few more care home staff and home care staff. But we are completing recruitment at the end of this month. So I think we've done a really good job together getting those interviews done. Next step will be to analyse them, again, jointly. So Hazel and Sue and Joe, who are our public advisors, they'll be supported in early January. We'll have a specific meeting to train them up in how to code some of those transcripts with our support. And then we've got the focus groups and co-production workshops as part of this. But just to kind of wrap up this as well, I hope this has been of interest so far, because we're still kind of in the early stages of recruitment of this. But the aim of this study, again, it's following a narrative. So once we've got this data and analysed, as part of the co-production workshops, we want to co-produce a funding application to develop a sort of support intervention for unpaid and or paid carers. So really, it's all heavily co-produced. And I think, yeah, that was my last slide. So thank you all. Thanks for listening. There's been too many organizations to put all the logos on, but I can tell you more about them if you have any questions. So thank you very much.